First, however, on vaccinations, more than 12% of Victorians 12 years and above are now had their 3 doses. And I want to thank all those Victorians who have come forward to get that 3rd dose. It is so important, and as all the data shows, so critical in protecting people from the Omicron variant. 93% of Victorians 12 and above have had their 1st and 2nd doses. Yesterday, 20,078 Victorians were vaccinated, and those numbers continue to grow since the state-run clinics in partnership with primary care providers ratcheted up the program once an extra 1 million Victorians became eligible on Tuesday. So please, if you are due your vaccination for that 3rd really important dose, contact your GP, contact your chemist, or contact one of the state vaccination hubs. It is just so important to get that 3rd booster jab. It's the strongest intervention you can make to protect yourself from this growing chain of transmission right across our community. In regards to people with COVID-19 in Victoria yesterday, we see currently 631 Victorians in hospital. That's an increase of 40 from yesterday's figure. We have 100 people in intensive care. That is slightly down on the day before. And we have 22 Victorians currently on a ventilator. That is slightly up on the figure from yesterday. Very tragically, 6 further Victorians lost their life with COVID yesterday, and we take this opportunity to send our condolences to those families and loved ones. That must be a very sad time for all those involved, and we wish them our best thoughts and prayers. There were 21,997 people formally diagnosed through the PCR system yesterday with COVID-19, and that was from the figure of some 64,861 Victorians tested through that PCR system where the results came in yesterday. That's a infectivity rate of about 1/3 and points to the huge pressures that the PCR system is having, and hence the kind of changes that were endorsed yesterday by National Cabinet around rapid antigen testing, and we'll come back to that in the very near future. What it is clear is that we are in a new phase of this pandemic and a new phase of how we need to respond. The strategies of the last 2 years have served us very well in regards to those earlier variants. We need and are indeed changing to a whole heap of other new approaches when it comes to how we respond to the Omicron variant. This has to be a system that responds to us as we now need to transform many aspects of how we manage the Omicron variant in this pandemic. One where technology such as rapid antigen testing is at the heart of that response. One that protects the PCR system for those who need it most. Understanding that at the moment there are some really significant issues of access to both. That is why we are working through some of the changes that we will go through. Yesterday at National Cabinet, the Commonwealth, the states and the territories discussed how to make sure that this rapid antigen testing technology is at the heart of this Omicron variant response. And it's in that regard that Victoria had been doing some preparatory work in regards to the issue of how do we ensure those people who test positive on the rapid antigen tests are included in the public health and primary health care responses to get us through the challenges that we are seeing at the moment. That is why we've ordered, as the Acting Premier pointed out yesterday, some 44 million rapid antigen tests are due to come in and start to come in the coming weeks, with at least over 700,000 coming in very current time frames of the next day or so. And it's in that regard that the important issues of how rapid antigen testing is at the base of people self-reporting. Getting a positive rapid antigen test is important, and that's important for the individual, their close contacts, their family members, and indeed ultimately their workplaces and their education settings. But it's also important that we all in the healthcare system have access to that positive test as well. That's why today I will be signing pandemic orders that recognise people with a rapid antigen test as a probable case, as a new description in the pandemic orders. But what it will mean is essentially they will have precisely the same obligations and the same rights as someone, whether it be for clinical support, whether it be financial support from both the state or the Commonwealth, and a whole range of other opportunities to be part of that primary healthcare response to keep them safe as they work through their infectivity. Essentially, this new category, based on a rapid antigen test, will be the same in the system as if you were diagnosed through a PCR system. These orders will come into effect as of 11:59 p.m. tonight, and Professor Cowie, as the Acting Chief Officer, will speak in more detail about how people who turn positive based on a rapid antigen test will have that information captured and shared. The goal is to make sure that we have less time at testing centres, and that as a result people focus more quickly on the thing that is most important, getting through that COVID infective period and getting better with the support you need as quickly as possible. We appreciate that at the moment, with the shortages of both rapid antigen testing and the difficulties that creates in accessing the PCR system, that there are transitional issues that the Prime Minister referred to in his public comments. We are committed to working through those as quickly and as safely as we possibly can. Also, from tonight, there will be further changes insofar as the density quotient arrangements apply in some areas of hospitality and entertainment. A density quotient of 1 person per 2 square metres will be in place for indoor entertainment and hospitality venues, which is a similar rule that has been in place in New South Wales since before the new year. The exception to this will be indoor seated cinemas and theatres, where because people are seated and masked, there are other factors at play that allow us to make this exception. We think this is a sensible change, particularly in the face of the continued huge growth in transmission, particularly amongst young people. Yesterday's formal figures, 40% of those cases were people in their 20s, and every indication is it's overwhelmingly from hospitality and related environments. The interaction in those hospitality and entertainment venues is close, it's crowded, it's active, and it's mobile. It's what young people do. We don't begrudge them that. These relatively mild restrictions are about making sure that that activity can continue, but it can continue in a less congregated and less active space when it comes to hospitality. There's nothing wrong with seeing your family and friends at hospitality venues, but indeed there's nothing wrong in seeing those venues in an outdoor environment, which is even safer. These measures, we hope, will facilitate both the continued operation of the hospitality sector, whilst at the same time encouraging greater activity outdoors. In addition, we will reiterate the very strong recommendations to businesses and to their patrons when it comes to avoiding indoor dance floors and opting for seated service as a preferred method every time you can. It's about taking the measures that we know that will keep us safe as possible in the face of this mounting Omicron spike that we are seeing. We'll also continue a strong recommendation that if you can work from home or indeed study from home, that you should, and all of these orders will continue to be under active monitoring. I'll hand over to Professor Cowie, who will take us through more detail, particularly on the issue of how people who turn positive from rapid antigen testing will become part of our pandemic response. Thank you.
Thank you, Minister. So, given where we are at this stage of the pandemic, with really quite significant transmission of the Omicron variant in the community, and with the attendant very significant pressures on our PCR testing system, and with the millions of rapid antigen tests that Victoria has ordered about to arrive, it's clearly time to recognise that a positive rapid antigen test has the same authority as a PCR test. And certainly we know that based on laboratory data coming in, greater than 90%, and in some laboratories greater than 95% of people who have a positive rapid antigen test go on to have that positive result confirmed by PCR. So in the current environment, rapid antigen tests provide a really high degree of diagnostic authority. And that's why other countries around the world, including, for example, the United Kingdom, did shift to the use of rapid antigen tests in a similar way when they got to this point. So this is the biggest change to our testing system since the start of the pandemic. And in terms of context, I think it's important to reflect that the number of people that our PCR testing system diagnosed yesterday was greater than the number our PCR testing system diagnosed for the entire of 2020. And it's likely that in the first 10 days of this year, our testing system will diagnose more people than it did all of 2021. That's the sort of volumes we're talking about here. So these changes mean that people who, as the Minister said, who have a positive rapid antigen test will be considered as probable cases of COVID-19 and subject to the same requirements as people who have had a confirmed diagnosis through PCR. They must isolate immediately for 7 days and notify their contacts. It will also be mandatory for those individuals to report the result, the positive rapid antigen test result, to the Department of Health through either an online form or by phone. And this will allow the department to confirm case details, to monitor the ongoing spread of COVID-19 through our community, which is incredibly important for supporting planning around our health system responses, and perhaps most importantly, ensure that people can still access care if their symptoms are deteriorating or if they've got risk factors for progression, and also to access welfare and other support. Once a probable case has reported their result on either of those mechanisms, they will be provided critical information on the next steps, on their 7-day isolation period, and how they can access the care and advice they need to keep them safe, just as would happen if they had been diagnosed through a PCR test. So these online or phone-based and phone-based reporting systems will be active from at some stage during the day tomorrow. It is a simple form based on the kind of essential information that we currently glean from cases, including a check on the severity of their symptoms. Privacy will, of course, be protected, and translation support will be available through the coronavirus hotline. Probable cases will also be reported alongside our daily confirmed case tally so that everyone's aware of how the system is functioning in terms of providing diagnosis. Until rapid antigen tests are in increased supply, Victorians who have symptoms of COVID-19 or those who are without symptoms but are household or household-like contacts can still get a PCR test if they don't have access to a rapid antigen test at that point in time. But in the future, this change means that PCR testing can be reserved for specific circumstances, such as the confirmation of clinical diagnoses in vulnerable settings and to support critical workforce testing. So in terms of confirmatory PCR testing, anyone can still get a PCR test to confirm their rapid antigen test result if they wish. However, this is really only recommended for people who have no symptoms and who are not contacts. And the reason for that is they are the least likely to actually have COVID-19, and therefore that confirmation can be sought if there's an unexpected positive rapid antigen test result. For people who do have symptoms or who are close contacts, if those people have tested positive on a rapid antigen test, they are much more likely, as I said before, 95% likely that their PCR test, if they have it, will be positive. And so we actually are discouraging people at this point in time from going through and confirming a positive rapid antigen test if they have symptoms or if they're a close or household contact. Because, as the Minister was laying out just then, in our eyes, in the eyes of the department, you have COVID. And all of the requirements, the public health requirements around that, but also access to clinical services and welfare support is contingent upon that positive test. I'll also add that your requirements to isolate start at the moment you test positive on a rapid antigen test. So if you do elect, and we are discouraging people from doing this, but if you choose to confirm with a PCR test, you have to be, that has to be your one trip out of isolation. You're not allowed to go shopping, you're not allowed to go and visit people. You are in isolation because you have COVID-19. Briefly across the rest of the testing network, yesterday, as I was just mentioning, was another day of very high demand. There were some suspensions at major sites. Really continue to thank everyone for their patience in this challenging time, and also to thank our testing providers, those at the testing sites and the pathology crews who have been working so hard to try and address this fundamental challenge being faced not just here in Victoria and indeed not just in Australia but globally. I can also report that our pilot to distribute the rapid antigen tests at a small number of our fixed PCR testing sites yesterday was a success. Some 2,000 tests were distributed, rapid antigen tests were distributed to people we identified as not needing to go on to have a PCR, and a large proportion of the people that we offered those tests to took up the opportunity. That pilot will continue today, and the team will keep looking to refine the distribution methods and improve access as indeed the supply improves. Finally, on vaccination, as the Minister said, there is honestly nothing more important right now than all eligible Victorians going and getting that critical third dose of COVID-19 vaccine. Emerging data from the United Kingdom suggests that for people who have had the first 2 doses of vaccination, whether it's AstraZeneca or Pfizer vaccine, that the level of protection against symptomatic infection 4 months after the second dose has dropped down to maybe 10%. A booster dose of an mRNA vaccine, such as Pfizer or Moderna vaccine, will lift that protection against symptomatic infection to greater than 60% within 2 weeks, and much higher again protection against severe illness or indeed hospitalisation. So this is something we can all do right now to protect our health, to protect our health system, and indeed to put a downward pressure on COVID-19 transmission in our community. And it was great to see so many Victorians responding to that call and coming forward to be vaccinated yesterday and the day before. Around half the people who received their third dose yesterday were walk-up, so they didn't have an appointment. People are encouraged to book, of course, but the walk-up option exists for you. Just check the site online first to make sure that it is a site that accepts walk-ups. You can also, of course, book through your local pharmacy or general practitioner, who are have been such a fundamental part of Victoria's vaccination efforts and will continue to do so as we get third doses into every eligible Victorian and indeed scale up the 5 to 11 program. So our bookings went live yesterday for kids aged 5 to 11 through state sites, and I can confirm that over 7,300 young Victorians were booked in yesterday to receive their vaccination with that program starting from the 10th of January, so that these kids can now enjoy the same protection that the rest of us do, especially once those of us 18 and over get our third dose. And with that, I might hand back to the Minister. Thank you.
Thanks, Ben. Happy to take questions.
Slippery slope to lockdown, or is this going to be it with restrictions?
As I said, there's no plans to have lockdowns. I think they are a 2020-2021 iteration. We now see with such high levels of transmission in the community that we're in a new and different phase about how living with, coexisting with and managing really high levels of transmission has to be dealt with. Staying open and staying as safe as we possibly can is the key here, and we'll continue to monitor these measures as we deal with this very serious increase in the Omicron variant.
Does the density quotient apply for outdoor dining?
No, only indoors. We encourage as much outdoor activity as we possibly can. This is the best time of year for it, and it is the safest possible environment.
In a nutshell, Minister, why was it necessary?
Well, in a nutshell, because we are seeing such demands right across our healthcare system, not just our hospitals, our primary healthcare providers, our GPs are reporting increased demands and pressures on them. We need to take measures that are proportionate, that are reasonable and that are necessary to manage as close as we can to take the curve top off the huge spikes that we're seeing in cases, and that's about protecting our hospitals, which are increasingly stressed.
Excuse
and
me,
our primary care
Reuters.
providers as well.
How much are you anticipating these restrictions to slow the case growth down by? As you mentioned, New South Wales are similar ones, and it doesn't seem to have done much there.
You never get any measure for things that don't happen. We are confident that not today, not tomorrow, but in coming days, these measures will play a part in taking off some of that increase in growth. Having said that, all the projections, whether it be the Doherty Institute's work, the work that the Burnett Institute have done, all point to continued growth in infectivity levels for some weeks to come.
Talking about the need for those who test positive on rapid tests, it's basically soft support. Are we still going forward trying to find a technological way through that, like they have in Britain, and how long will that take?
As a result of National Cabinet's decision yesterday, we felt the need that we just can't cut people loose. You just can't say you're completely on your own. Go and talk to your GP. We have to have a system that captures the data and captures the support that people need for their journey through an infectious period. This is an initial step. We're confident it will work. What we'd much rather see, of course, is a consistent national approach, similar to, as I understand it, I haven't seen it firsthand, but it's been briefed to me about how the British system works, or the English system works, where every single rapid antigen test has its own unique barcode and can be linked into the system that way. We're not at that point, but more work clearly needs to be done in this space. We must have a system that brings people who tick positive through rapid antigen tests into the care and support system. We can't cut people off. We've got to support them. This is a really important step, and the orders come in from 11:59 p.m. tonight.
Is Victoria, though, on its own working on that?
No. We've shared our concerns through AHPBC and other forums with the other states and jurisdictions, and I know that these conversations are very alive right across the Commonwealth as a result of yesterday's National Cabinet decision.
So you hope there will be a national move to that same similar thing to the UK?
I can't speak for other states and I can't speak for the Commonwealth, but you'd always much rather have a national approach to how we deal with national issues in a global pandemic. When that's not available and when there's a real need, the states step in, and that's what we've done here.
Can you explain?
Well, it'll certainly be accepted. It'll, under our state pandemic orders, where the Commonwealth currently accepts a PCR confirmation as part of the proof needed for various Commonwealth supports, and the state obviously uses for state supports, and many employers use for whatever support they bring. These pandemic orders that come in tonight have the same status for rapid antigen tests as they have for PCR tests. So there's no reason for the Commonwealth not to continue to provide that support, subject to whatever other criteria they might apply to it. But as far as the state orders are concerned, it has exactly the same status.
Can you run us through how the reporting system is going to work? Is there an app where you take a photo of a positive test, or do you check a box? Or?
No. Maybe that's where we want to end up, through a more app-based system. But to get something out there and not leave thousands of people on their own, the initial process will be an online form that you fill out. And for those people from non-English speaking backgrounds, there will be the opportunity through the call centre for interpreter services to assist in that regard. And we are working with all sorts of other community representatives to get the message out through our Community Champions program, through our cold COVID networks, through a whole range of issues. We expect there will be issues, but we have to make a start quickly. So you'll log on or you'll ring up, and you'll just go through the same sort of information that you would expect that was provided in the PCR system. And that's to give our public health team, primary healthcare providers, the COVID positive pathways team for community support, that important data so they can reach out. You will then get exactly the same text message that you got if you had have tested positive through the PCR system, to monitor your conditions, to put you in touch with measures that you will need for information about what happens if your case deteriorates. So the goal is to bring it to as close to, if not exactly the same as, the same supports that the PCR reporting system had, and make sure that increasingly the rapid antigen testing system is the key part of our testing as we deal with this Omicron variant.
With the numbers in the coming days, will those RAT results be added to the PCR results?
Yes.
Or will they be distinguished?
They'll be distinguished, so you'll be able to see which ones are rapid antigen tests and which ones are
Lab or home kits?
correct. Yes.
And if someone has had both a rapid test and a PCR, will there be matching to make sure that they're not doubled up?
Will there be?
Sorry, if someone gets a rapid test and a PCR, can we make sure that they're not doubled up?
That's a good question. I'll come back to you on it, but once you're in the PCR system, and particularly in this transitional period, that will continue to be the core part of that data. We're obviously, for double ups and those kind of things, we'll try to make sure the system talks to each other, but as a result of the national, they all go into the same database called Trevi, but this is to make sure that we avoid double ups. But in terms of that specific question, I'll come back to you.
In terms of elective surgery,
Yes.
what was the thing that tipped it over the edge with the we've got to stop it?
The elective surgery decision, the deferring of all but critical elective surgery is a big step. And it's a big step that we've taken after consultation with our hospital providers, our private hospital partners, surgeons, hospital administrators and frontline health system people. What we are seeing with the increasing numbers of hospitalisations, that's people either presenting because of COVID or presenting for another reason with COVID, is the system that is already under stress through the normal demands that we're facing at this time of the year with reduced staffing. We are facing and will continue to face real challenges. So in that regard, so as to avoid the real challenges being even worse, we've made the reluctant but necessary decision to defer non-urgent elective surgery for a period of time to be constantly reviewed until we can get it to the other side of the stress and the strain that all of our healthcare services are facing. I want to thank those nurses, those clinicians, those doctors, the hospital administrators, everybody, both the public and the private sector, for their great work. This is about deferring that demand so as to keep those people who are the greatest priority, to triage the greatest need and the greatest resources to the area of greatest need, and that's what it's about.
Well, we've heard that Albert Park testing station will be closed on the weekend. Is this a part of the transition away from PCR? That's been one of the most popular testing sites.
Well, I haven't heard about that particular site, and I can come back to you on that. But we have seen a number of, particularly the private sector providers, shut particular sites to deal with the huge backlog that they're facing. When we see a third of cases being tested through the PCR system turning positive, that slows down the system enormously. When you're at 1, 2, 3, 4, 5% positive rates, the system can keep up with those arrangements. But at this level of positive tests that we're seeing in the community, the pathology system, as it's designed, can't keep up. That's why National Cabinet made the decision, which Victoria fully supports, to make this transition now to the rapid antigen test system to make sure that these issues can be quickly got on top of. We recognise totally that there are real challenges in getting access to both rapid antigen tests and PCR tests at this moment. That's why we're working very hard, right around the clock, to address those demands.
Would you consider just making it a given that symptomatic close contacts have COVID and that they don't, if they can't get a RAT test, they can just be classified as COVID to take further pressure off the system?
Well, I'd take public health advice on those balanced issues between the increasing demand issues and getting people the care and support they need. I haven't got that advice yet, but we'll continue to monitor the situation as it emerges.
And what's your estimation as to the number of people who actually have COVID in Victoria? What's your department telling you? Just a ballpark.
That approximately 1 in 50 Victorians is currently positive with COVID. That 50, but by the time we get to Victorians in their 20s, I think it's about 1 in 20 or thereabouts.
So are they official figures?
That's the advice that I've got, but this is really rapidly moving, and I will seek further confirmation of that, but the initial cut suggests those kind of figures.
Sorry, first off, can you reiterate that the 20, the people you've got in their 20s? Sorry, we just missed that.
So people in their 20s, given the large number of cases that we're seeing, some 40+% of current cases are people in their 20s. About 1 in 20 Victorians who are in that age group currently have COVID.
Are you seeing any difference in ICU, people in ICU? Are you seeing more vaccinated, fully vaccinated people enter ICU?
Not necessarily, no. We continue ICU, which is a lag indicator, running some weeks behind infectivity. We continue to see in the most recent data I've seen, people being disproportionately unvaccinated.
When back to elective surgery. The main problem for the hospitals at the moment is the fact they've got so many people in there at the moment with COVID and all the precautions, all the staff fallout.
Yes, true. It's both a combination. Our hospital system is under stress like never before. After 2 years of exhaustive work that those frontline and their support staff and their executive teams have been at this 24/7, some of them working double shifts every day in full PPE, they have been working like galley slaves and they've been keeping us safe. At the same time now, we are seeing, in addition to that, high levels of infectivity in the community that is seeing large numbers of healthcare workers having to be furloughed or being close contacts or being the carers of people who have been turned positive. Then add to that the demands in the hospitals themselves about different mechanisms of how you have to deal with increased numbers of people who are positive in the healthcare system. That's been a combination of factors that have brought together pressure on the system like never before.
The hospitality industry is saying they're always getting 50 results. They feel like today's another 50 results. How would you address that?
Look, we've seen similar arrangements in New South Wales continue to see that sector operate in a really vibrant way. Over the course of the last few months, and particularly over Christmas and New Year, we saw the hospitality sector absolutely thrive. At the same time, we also saw cases, particularly in the most mobile, socially active groups, take off. We have to balance those two competing demands in a way that protects our healthcare system and keeps those businesses viable and operating and responds to the ongoing pressures in our healthcare system. We think we've achieved that balance.
When did you first receive advice from health officers to introduce these capacity restrictions?
Well, as the public advice shows, under our new pandemic legislation system, we've had a series of advice over the course of, since the new laws came in, before Christmas and subsequent to Christmas, almost on a daily basis. I seek advice from my public health team on these matters, and when we make decisions based on that advice and other factors, we publish both that advice and my reasons for decisions.
So when did you first receive that advice?
For
To introduce these capacity restrictions for hospitality?
I think the public record shows the 23rd of December.
Why didn't you introduce those restrictions back then?
Well, as I indicated at the time, the new pandemic legislation requires a range of factors to be taken into account in the Minister for Health's decision-making processes now. We did in fact turn most of those recommendations into orders, particularly when it came to face mask wearing and other measures, and they continue on. In regards to the balancing of economic, social, mental health, cultural and just family reasons, that was the appropriate decision based on the information and circumstances at the time. Now, with further information and further data available to us, and after consultation with a wide range of groups, I've made this decision thinking it to be an appropriate, necessary and proportionate balancing of competing demands.
Did you get advice today to shut down schools and
Well, indeed, that was part of the advice from the 23rd of December.
You received advice about the Australian Open and whether that can go ahead with all crowds?
What I've sought advice, what I have asked for advice from is how can we make sure that we have a safe events calendar and particularly a safe Australian Open. And I am confident that the Australian Open will continue and will go forward with a very strong crowd. But what we need to work with Australian Open constantly on the details is how can we make sure that that occurs in light of the growing Omicron variant. We managed to do that pretty successfully at the MCG, and I'm confident that we can do that at the Australian Open.
So at this stage, no density limits?
No.
for the Australian.
on the topic of the Open, the federal government said that it provided advice to Victoria, Tennis Australia, that a COVID infection within 6 months wasn't a valid exemption. Is that true with your recollection of events?
In what context?
In the context that the exemption that was given to Novak Djokovic was about was allegedly about whether or not he may have had a COVID infection.
Well, let's be clear. There are 2 steps to anyone associated with the Australian Open from the international community getting to play at the Australian Open or to be part of it. The first is you get a visa. Someone issued a visa to everyone that's come to Australia. It's not the state. The Commonwealth issues those visas. Then the second step is you then need to establish, in accordance with the Australian Technical Advisory Group's recommendations and guidelines, the criteria for either being vaccinated or being exempted on very narrow grounds from that. So there's 2 steps. The Commonwealth lets you into the country. Tennis Australia, in partnership with the state, lets you into the tournament. Someone issued Novak Djokovic a visa, and it wasn't the Victorian government.
But the federal government's essentially saying that the ATAGI advice doesn't say a COVID infection is a valid exemption. Are they being misleading when they say that?
Well, I'm not here to comment on what the federal government might background individual journalists about. I'm here to talk about what the evidence of the world that we actually live in. There's a 2-step process. You either get into the country. Victoria doesn't say Victoria on the Australian passport, it says Australia. The Constitution makes it pretty clear that it is the Australian Commonwealth that issues visas. Although, given how much the Commonwealth seems pretty keen on outsourcing responsibility to the states on most things, who knows what the future will bring. But let's be clear, 2-step process. First, you get into the country on a visa. Second, you get into the tournament based on strict criteria that are in the guidelines published on their website by the Australian Technical Advisory Group. Someone issued Mr Djokovic a visa, it wasn't the Victorian government.
So just to be clear, the visa was issued before the Victorian government became involved in any way?
Well, I wouldn't know because we don't issue the visas.
But why did you're saying it's a 2-step process and you're blaming the federal government?
I'm not blaming the Commonwealth. I'm not blaming the Commonwealth on anything. All I'm saying is that there's a 2-step process. You get into the country, that's the Commonwealth of Australia's responsibility for a visa. Then you get into the tournament. And the tournament had the process that the acting Premier went through yesterday. A blind process based on the criteria published under the guidelines of the Australian Technical Advisory Group.
So does that mean Victoria just assumed that the visa was issued and fine when it went through that process?
As I understand it, some 3,000 people have come to Melbourne associated with the Australian Open who went through that same process. So the safe assumption that we've been working on is that the Commonwealth issue the visas, we determine in partnership, well, it's led by Australian Open, but in partnership with the state, who then gets to play in that tournament once they are here.
And a federal government representative involved in that process as well, with the state and the Australian Open?
Not directly, but we did write to the Commonwealth about the whole process last year to alert them to the process that was in place.
Do you maintain that the Victorian government followed the ATAGI advice as it appears on the website?
The Australian, I urge you to have a look at the Australian Technical Advisory Group's website and the guidelines that it has. Those guidelines formed part of the 2-stage process that the Australian Open and the 2 independent medical panels went through. And that's all based on the fact that you have to have an Australian government approved visa to get into Australia if you are not an Australian passport holder. That 3,000 people have done that. Why the Commonwealth have chosen the course of action they have with Mr Djokovic is a matter for the Commonwealth.
Is this an embarrassment?
I'm not embarrassed by it, if that's the question. What the Victorian government has done, what Tennis Australia has done, is acted in accordance with the law of the land. It's a 2-step process. The Commonwealth issues visas, not the Victorian government. You get into Australia, then you go through a process based on that approval to be part of the tournament. Thousands of people have gone through that process. You have to ask the Commonwealth why they've chosen the course of action they have.
The process has been a bit messy, but is this a good outcome?
Any messy process is not a good outcome, as we've learned over the course of many, many years of this global pandemic in its operation. But the message to our frontline healthcare workers, as the Premier has made clear, as the Acting Premier has made clear, as I've made clear when asked, we have done the hard yards in so many ways to get our vaccination status the key pillar of how we respond to this global pandemic. And those, whether they be international tennis players or anyone else who want to undermine that, they undermine the confidence of the Victorian community around that pandemic response. So those who choose to undermine that, that's their business. I wish they wouldn't. Vaccinations work. We have seen it in the first iterations, first 2 years of the global pandemic. We have already seen data about how effective in both protecting you from acute disease or infectivity third booster jabs are, and anything that undermines that confidence, I think, is reprehensible.
I just have one more on behalf of Bridget Dollison. She has a wedding in 2 days and wants to know if she can hit the dance floor under any restrictions.
Well, you can tell Bridget that we'd rather she had that dance floor outside and that she'd do that in a COVID-safe way. The very strong recommendation is that you avoid indoor dance floors whilst we are in this very challenging Omicron period. Anything else? Thanks everyone. Ta-da.
Thanks, Nathan.
And thank you, Sarah, again, individual.